Hey everyone, so I wanted to finish off the last part of Unit 7, which is our musculoskeletal disorders, or more specifically, amputation. So, some of the indications for amputation include poor circulation, necrosis, infection, or gangrene. One of our high-risk groups is diabetes patients because of their peripheral neuropathy or diabetic retinopathy, and that can lead to an infection because they can step on something and not even know that they stepped on it. There's two different types. There's elective versus traumatic. Elective is usually perfusion related, while traumatic is due to an acute injury. So the diagnosis to help with this is a physical exam, of course, and we can use imaging and vascular studies. Most are related to chronic vascular diseases such as diabetes or peripheral arterial disease or PAD. So why are vascular studies done before elective amputation? It's because that helps determine viable tissue level and to ensure adequate perfusion for healing. When we talk about amputation management, we want to make sure we provide rigid dressing. This helps reduce edema, and we want to make sure we remove or replace the dressing as ordered. Rehab is going to be necessary for these patients and really important so that we can maximize their function and try to get them as independent as possible post-operatively. If necessary, we can use a prosthetic fitting. And with these people, psychosocial considerations is going to be very important. So support groups can help. For the nursing interventions, we have to make sure we control their pain as well as phantom pain. We can use sandbags for spasms as ordered. This is because when amputations occur, muscle tissues get damaged, which can lead to muscle spasm. And when we put sandbags or pressure on those muscle spasm areas, that can help reduce that, which can ultimately reduce pain. We also want to make sure that we do proper wound care, so proper sterile technique to help prevent infection. And we want to make sure we're mindful about enhancing their body image. This is to help prevent any kind of anxiety or depression that comes along with this. So we got to make sure we support grieving, and we have to make sure they know how to safely position themselves, whether that's elevation versus prone, depending on what the order is. One important thing to know is that phantom limb pain is real neuropathic pain. So why is prone positioning sometimes ordered after lower extremity amputation? Well, it's to help prevent hip flexion contractures. Now moving on to some of the complications that can happen, we can have hemorrhage, hypoperfusion, phantom pain, infection, neuroma, flexion contracture. With hemorrhage, we want to make sure we monitor the vitals and dressing saturation. For any infection, monitor for any redness, drainage, odor. There's going to be an increased risk for infection, especially with poor perfusion. Neuroma is essentially a benign nerve growth causing pain. This is related to scarring and inflammation that can happen that can irritate the nerves. And for phantom limb pain, we want to make sure we take care of the neuropathic pain and treat it with meds and therapy. For the flexion contracture, we want to make sure we avoid prolonged flexion, meaning no pillow under the stump for a long period of time. And of course, with this type of procedure, there's going to be loss, grieving, and lifestyle adjustments that need to be made. So make sure you consider the psychosocial effects. With any kind of contractures that occur, just remember that this can delay prosthetic use, so we want to minimize that as much as possible. So remember, we want to make sure that pillows don't remain under the stump so that we can help prevent flexion contractures. Now here are some of the nursing diagnoses associated with amputation. The acute pain is usually related to incision or phantom sensation. Impaired physical mobility is related to limb loss and pain and needs physical therapy and occupational therapy. Risk for infection is usually related to the surgery and the surgical wound that it leaves behind. The disturbed body image is usually related to the loss of the limb, which can affect their sense of identity. And this is a major lifestyle change, so this can affect their risk for ineffective coping. Psychosocial care is a priority with physical healing. And always remember that early PT and OT involvement can help prevent complication and promote independence. So this is an essential need. Alright guys, so that's pretty much it for amputation. So if you have any questions about any of these materials, so Unit 5, 6, and 7, let me know and we can talk. I'll see you around.